So effective immediately, we're extending the emergency declaration and prolonging the stay-at-home order province-wide for an additional 2 weeks, for a total of 6 weeks.
Violence and woke jargon is up in Ontario schools post-COVID pandemonium, while tangible learning and academics are way down. So what is really going on in the school system these days? Tamara Ugolini here with Rebel News to highlight a report published recently that surveyed Elementary Teachers Federation of Ontario, the EFTO, members that made a shocking discovery. The survey discovered that reports of violent occurrences are up by 70% in Ontario elementary schools since 2017. According to the report that surveyed nearly 25,000 of approximately 83,000 members, more than 3/4 of teachers have experienced or witnessed violence in schools. That means that 77% of respondents reported seeing an alarming increase in violent occurrences in the classroom. It reads, 4 out of 5 members, that's 80%, state that there are more incidents of violence in schools since they started working in the Ontario public elementary school system, and 2/3 of members, 66%, say that the severity of violent incidents has increased. The vast majority of members, 80%, agree that violence is a growing problem at their school. Almost 3/4 of members, 72%, state that the number of violent incidents has increased since the beginning of the COVID-19 pandemic. Not only does this violence create unsafe working conditions for teachers and school staff, but it negatively impacts the learning environment for all of the other students in the classroom. 83% of respondents reported that violence interferes with classroom management, an increase of 4% since 2017. Underreporting of violent occurrences seems to be on the rise too. According to the report, 63% of EFTO members say that school administrators do not take the problem of violence in elementary classrooms as seriously as they should. So it is unsurprising that only 41% of members made a formal written/online report. A mere 36% of respondents said that their formal reports were followed up or investigated, a decrease from 50% based on 2017 survey results. A minuscule percentage, only 8% of respondents, said that the follow-up actions to prevent further violent incidents were effective. Not only has violence increased in the classroom by 70%, but administrative follow-up is at an all-time low with ineffective strategies to stop repeat offenses. The added stress placed on education workers throughout the COVID pandemic has further contributed to severe staffing shortages, further compounding the ability for these frontline workers to approach violent situations. A lot of teachers retired early or went on stress leave, said Ontario educator Jay McCurdy at the National Citizens Inquiry in Toronto on April the 1st. McCurdy has 24 years of experience as a teacher, and he testified about this several weeks before the survey results were published. He spoke in depth about how the educational system was damaged by the extreme triage responsibilities put on the shoulders of teachers and school staff who were left to enforce public health measures despite having no medical training. Here are a few short clips from his April 1st testimony. Check it out.
I could go all day long with just those, like I said, as a teacher, experiencing the children, how they were being asked to learn, the conditions of which were atrocious for learning, wearing masks the whole time. It's a whole other thing, right? It's sometimes arbitrary. I can tell you a quick story about masking. Is that masking was enforced incredibly for the 2 school years, 2021 and 21-22 was enforced strictly for 3/4 of that time. It was in the spring of 2022 where the students we could demask and the regulations were lessened. If a student, I'd often see staff members yell at students for not having their mask on. Get your mask on. Masks would slip down, so they're constantly being told, get your mask up. During eating time, of course, masks can come off and they can eat, but they can't talk. If they were talking, they would get yelled at by the supervisor. You can't talk. You're either eating or you're talking. If you're talking, your mask is on. So that's for almost 2 years, a hard thing for a little kid to kind of navigate, you can imagine. Stressful for the teachers to feel like they had to enforce that the whole time. And those are just sort of minor things, but very major things that the outcome of that, I feel, has been deeply felt by, the students and their age of development, not understanding what was going on, why, and being so fearful of the whole time. And as we all know right now, the case fatality rate for children is incredibly low. They were never at risk. I teach a unit. I'm just finishing up a unit on, for example, right now we're doing angles. We're doing angle relationships. I teach it, let's say it's a 2-week unit on that, and then I'm pretty old school. I give a quiz, and the acquisition of the information, the knowledge, how to learn, would be, it's just a certain sort of expectation that I have versus I teach for 2 weeks and I administer a quiz, and it's just not there. They're not acquiring the knowledge at the same rate. They're struggling, even with test taking. There's anxiety, massive amounts of anxiety with test taking. There's so many things that I'm seeing. I would suggest that it was sort of, we're kind of like frontline workers. I don't know if there was on a day-to-day basis much reflection. It was just get through the day. It was a lot of stress. COVID teaching was very stressful, especially in the school year 2021, and even the fall of 21, the next school year. Getting through the day was just like triage. It was get through the school day. We all know it's just how challenging it is to teach under COVID conditions and restrictions and limitations in the school setting. What you're used to being able to do versus what you're being forced to do. Just such a challenge. We were all thinking it. We were all living it. I don't think there was much discussion. It's almost like it's not even close to be, in terms of equating it to healthcare, what it would have been like to work in a hospital, during the heavy waves, perhaps, where the stress level on the nurses and such, and the system is collapsing because there isn't enough staff, right? So, and that's another thing that happened basically, was that during COVID, the stress levels of teachers went up, and a lot of teachers retired early. They went off on stress leaves and such. So we were living it, and we weren't discussing it too much, but it's almost like you wink and nod to your colleague and say, here's another COVID day. We have a board in our office where it's an absentee board, and you can walk in on any given day and see which staff are off and who's filling in for them. Something became sort of very patterned during COVID, is that the board would be full. It would be long, full, and you would have multiple staff off during any given day because of various reasons. Maybe they had COVID, maybe they were sick. But the proceedings of their school, in terms of administering education and every day, and it's managing the building with just the prevalence of misbehavior, and in an elementary school, we might not use the word. We can use the word violence, but we're talking about children having temper tantrums and throwing chairs, and there are staff getting hit with chairs. There's staff getting hit with items, and some of these special needs scenarios are sort of extreme. But administrators are having a heck of a time trying to sort of navigate and mitigate sort of the outcome in terms of how the children are coming out of COVID. I just think that the system damage is that there's just pressure to keep the school healthy, the school system's healthy, so that learning can happen. Learning is critical, and learning is being compromised right now with the collective stress of the children and the collective stress of the adults, combined with sort of this misbehavior, is just making teaching and learning challenging on a day-to-day basis, and it's very challenging. Like I said, I'm very experienced at my job, but I'm seeing younger teachers not equipped to cope with this, and younger and younger administrators not equipped to cope with managing it as well, in terms of the higher level of misbehavior and violence in the schools.
As McCurdy continues, it's easy to identify that the 28 weeks of government-sanctioned school closures imposed on students, coupled with 3 years of forced social isolation due to COVID-related public health restrictions, devastated generations of children. Ontario saw the harshest and longest school closure out of almost every developed nation globally, with zero evidence to justify it. And Premier of Ontario, Doug Ford, seemed proud of his authoritarian iron fist.
So effective immediately, we're extending the emergency declaration and prolonging the stay-at-home order province-wide for an additional 2 weeks, for a total of 6 weeks. We have implemented the strictest measures in all of North America.
Of course, McCurdy also spoke in depth about the role that masks played in perpetuating psychological trauma on children and hindered their ability to form healthy communication strategies or communicate at all. According to a research report from the American Institute of Economic Research from April of 2021, it said the following about children and masking. Their immune systems are still being developed, and we are forcing lockdowns, school closures, and masking on a developing child, and we have no prior experience on the subsequent outcomes pertaining to children's development, health, and well-being. We're starting to see it now. Yet up until as recently as January of 2022, education unions rallied behind continued and harshly imposed pandemic-related public health restrictions. In this joint letter from education unions to Premier of Ontario Doug Ford, signed by the president of the Elementary Teachers Federation of Ontario herself, Karen Brown, they called on the government to increase effective vaccination rates by publicly promoting the importance of vaccination for students, to add COVID-19 as a designated disease under the Immunization of School Pupils Act, for improved guidelines to ensure masking compliance, stricter screening and isolation requirements, robust testing and contact tracing regime. They called for the enforcement of vaccine passports and continued masking in all indoor spaces. Fast-tracked to publishing of this violence report, Brown says that students would never choose these behaviors. This is symptomatic of a system where students are not getting the supports and resources they need, not for their education nor for their mental health. Brown appears completely unaware that the very policies and restrictions that she rallied behind played a role in the school environment felt today and these students' mental health. Meanwhile, it's children and the teachers tasked with trying to teach left struggling. For Rebel News, I'm Tamara Ugolini. Keeping kids' spaces safe should be a no-brainer. If you agree that all children should have access to gender-specific safe spaces, including at school, then consider signing our petition and staying up to date with all of our reports at keepkidsspacessafe.com. That's keepkidsspacessafe.com.